After baby G's collapse, doctors began trying to work out what had caused it. They stopped baby G's milk feeds and ordered x-rays and blood tests. They also decided she needed intravenous fluids and antibiotics in case she had an infection.
A decision was also made to try and move her to the intensive care room, Nursery 1, for one-to-one care and closer observation, and another nurse, who we can't name for legal reasons, became her designated nurse.
But before she could be moved into Nursery 1, the doctors needed to insert a cannula into baby G so they could get these fluids and medicines into her bloodstream. The court heard that several attempts were made by different doctors to find a suitable vein, but because she'd been so poorly and previously had lots of treatment, this proved tricky. Eventually, the most senior doctor in charge, that's consultant paediatrician Dr John Gibbs, and another registrar, Dr David Harkness, were both called to help.
They arrived in Nursery 4 shortly before 3:30, and because there were at least 2 more babies in cots in the same room, a portable privacy screen was put up around baby G while they carried out the difficult procedure. Jurors were told they eventually managed to get the cannula into baby G's left foot at the 7th attempt.
Baby G's mum left the nursery while this was going on. Baby G's designated nurse also went out because she was looking after another baby elsewhere, and the doctors left the room once the cannula had been inserted.
Moments later, Lucy Letby, who was looking after at least 2 other babies in the same room, was calling for help after baby G collapsed again.
Baby G's designated nurse gave evidence that she was called back into Nursery 4 by Lucy Letby. She said as she got to the door she saw Lucy Letby beside baby G, giving her rescue breaths with a mask because her oxygen levels had dropped again. The privacy screen was still up, but she said a machine, which was supposed to monitor baby G's heart rate and oxygen levels, was off. This was not normal protocol, she told the court. She said, Lucy Letby said baby G wasn't breathing. I could see she wasn't. She didn't look well at all. She was a pale colour. She wasn't moving. The monitor wasn't on. The actual physical screen was off.
Liz, it's the prosecution case that Lucy Letby turned off the monitor before attacking baby G and sabotaging her care for a 3rd time.
But when baby G's designated nurse gave evidence in court last week, she told the jury that she didn't think Lucy Letby could have been the person who turned the machine off.
And why did she say she'd come to that conclusion?
She said that after baby G collapsed, Dr Gibbs and Dr Harkness had come to see her in the corridor. She said they apologised for leaving baby G behind the screen after they finished inserting the cannula, and for not switching the monitor back on. Ben Myers, KC, Lucy Letby's barrister, questioned the nurse about this and suggested that Lucy Letby had been cross that baby G had been left like this and urged her to report it to management. The nurse said she had no recollection of talking to Lucy Letby about it, although she did admit she was so concerned that she had reported the matter to the neonatal unit manager, Arian Powell.
But neither Mrs. Powell, Dr. Gibbs or Dr. Harkness could remember talking to the nurse about the monitor.
That's right, Caroline. Dr. Gibbs said he couldn't remember if the monitor had been detached from baby G, but insisted it was not his usual practice to do this. Dr. Harkness also said it was highly unlikely that he would have turned off the machine. But Dr. Gibbs accepted that if the nurse remembered he and Dr. Harkness apologising for forgetting to put the monitor back on, then presumably that's what happened.
So after baby G's collapse on September the 21st, she recovered and remained in the neonatal unit at the Countess for several more weeks. On November the 2nd, when she was 156 days old, she was finally well enough to go home.
Yes, but jurors have heard that it wasn't until she had a scan aged 15 months that the full extent of the damage to her brain was revealed.
Now aged 7, baby G has spent repeated periods in hospital and is still under the care of doctors at the Countess.
She has been diagnosed with a serious form of cerebral palsy, which has left her with life-limiting problems. She's unlikely to ever walk, is visually impaired, is fed through a peg into her tummy, and needs round-the-clock care from her parents.